Hello, I'm Dr. Terry Lowry. I'm a cardiothoracic surgeon at UNC Health Southeastern. I grew up in Robeson County and lived here my entire life before traveling to UNC, where I completed undergraduate and medical school training. I went to Rochester, New York, where I completed my surgical residency and cardiothoracic fellowship training before returning back to Lumberton. I became interested in cardiac disease because I spent some time living with my grandmother and she had multiple medical problems, but her primary problem was heart disease and suffered several heart attacks before she finally passed. And that's pretty much how I became interested in cardiac therapies. So currently, the services that we provide include open cardiac surgical procedures. We do coronary artery bypass surgical procedures, as well as valvular heart disease surgical procedures. We do other types of procedures on the heart, including sometimes biopsies. We also perform a large volume of vascular surgical procedures, either peripheral vascular disease or carotid artery disease, as well as providing services for hemodialysis access. We also perform procedures in thoracic surgery. That includes minimally invasive as well as open procedures for lung resections for cancer and or biopsies, as well as treatment of other inflammatory type processes. So our goals when we're treating a patient is not only to treat their medical problems, but to try to educate them so that they have a better understanding of what's going on with their health and they can help us to manage their health going forward. Having grown up in Robeson County, I really have a keen understanding of how patients interact with their loved ones and extended family members because I grew up with the same experience. So we try to extend that same relationship with our patients. And again, we strive to educate our patients about what things they need to do in order to improve their health, as well as treat whatever issues they have once we see them. So one of the things that is, really clear based on all the research and evidence that we have related to cardiac disease is that family plays an important role. It's not only the things that we do in terms of high cholesterol diets, obesity, and tobacco abuse, but also the genes that we inherit from our parents. So a lot of the time when we see patients, part of that training that we try to achieve to help them better manage their health is that there is a genetic component. So the things that happen to their parents they may experience at a similar age unless their lifestyle habits change. When I went into cardiothoracic surgery, that we spend a lot of time at work, and the things that we do are quite stressful at times, but there's a big reward when we help someone return to health with a longer life expectancy. That job becomes exceedingly easier when you're surrounded by people who, number one, know what they're doing, and number two, are good to work with. And so we have a very close-knit group of people that we work with in the operating room and in our intensive care unit. And it's almost like family because, again, we spend just as much time here with them as I do at home with my own family. There's an old saying that says that you need a village to raise a child. We sort of see that as a similar concept when we're taking care of patients. We have a team. It's not just me taking care of a patient, but it's an entire group. We have anesthesiologists, nurses, surgical techs, all the respiratory therapists, all the various people that are involved in caring for these patients. And just like we work together as a family, we interact together to try to provide the best care that we can for each individual patient. And so, again, the whole family concept and working together as a group to get the best care. And part of that group is going to be the patient themselves working with us to help improve their health.